Last year's decline in life expectancy, largely driven by COVID, erased 25 years of gains. This drop brings us now to an average life expectancy of 76.1 years, which is about 3 years down from its peak. Life expectancy plateaued in 2015 and then started falling during the pandemic. And get this, 39 countries now have a greater life expectancy than the U.S., according to the World Health Organization. This decline in life expectancy has not hit all communities uniformly. Compared to the average of 3 years decline, Indigenous Americans saw their life expectancy drop by 6 years during the pandemic. Black and Hispanic Americans lost about 4 years, while life expectancy declined by 2 years among Asian and white communities. So what's causing this drop? Well, a new report from Bloomberg American Health Initiative found that the leading causes include, of course, COVID-19, overdoses, gun violence, suicides, motor vehicle fatalities, and health issues like heart attack, stroke, and diabetes. COVID-19, as I mentioned, accounted for the largest decline in life expectancy, but you might not realize by just how much. 77%. It is now the third leading cause of death in the United States, followed by drug overdoses, which more than doubled from 2014 to 2021. And then the third largest contributor remains the health issues of heart attacks, strokes, and diabetes. Researchers also noted a worrying trend. Gun violence is now the fourth largest contributor to life expectancy decline. And as of 2017, gun violence is the leading cause of death for children, adolescents, and young adults. And one important note, of course, this report doesn't measure certain major health concerns like cancer and lung diseases' impact on life expectancy because those are very long term. But researchers say that it provides an illustrative look at the declining mortality rate.
Dr. Joshua Sharfstein joins us now. He is the director of the Bloomberg American Health Initiative at the Johns Hopkins Bloomberg School of Public Health. Since COVID-19 was the largest contributor to the life expectancy decline, Dr. Sharfstein, what solutions would you implement to reverse the impacts moving forward?
Well, one of the most important things is for people to be vaccinated and boosted. That is the single most important thing to dramatically reduce the number of Americans who are dying every day. But to do that, Congress really should be continuing to fund COVID response efforts because, as we've learned, it's more than just having the vaccine somewhere. It's getting them out to people in their community, and public health agencies are really well equipped to have partnerships to do that.
We already knew that there was a racial disparity in life expectancy, but I think one of the things that's so worrying about this new report is seeing that those gains were actually augmented, that the groups that are most at risk of having a shorter life expectancy, like Indigenous Americans, that doubled over the national average. So how do we begin to bridge those disparities in life expectancy?
That's right. The life expectancy at birth for Indigenous Americans is like 65 years. I think it's been decades since it's been that low. So this report is both about the overall decline and the serious inequities that this decline reveals. And you have to pay attention to those inequities in order to address them. It's not a one-size-fits-all approach. You have to look at what is driving those inequities. So an example might be teen suicide. You know, every single one a tragedy, 2,700 suicides a year. We have to make sure that all young people are able to be treated when they are depressed, when they are anxious, with support, with care, with health care, rather than punished, pushed away, pushed out of school, or even into juvenile detention. We have to make sure we're not embracing policies that actually treat people differently. So really understanding for each of these causes what is behind that inequity is the first step in resolving them.
You know, one of the numbers that is striking, and of course I've been reporting on this, is the fact that the leading cause of death for young people is gun violence. So, you know, with that in mind, what are some of the examples of what federal, state, and even local officials can do to increase the life expectancy of, you know, people in this country?
Sure. Well, there are gun policies that have very broad support, including among gun owners that work in parts of the country but could be expanded. And one of those is called extreme risk orders, where people who are in a very dangerous state can have their guns temporarily removed. And those, it's estimated that when that happens, out of every 10 to 20 times, at least a suicide is prevented. And there's stories of mass shootings being prevented. There are also laws called permit to purchase laws, where you need a permit to get a gun. And when those are in place, you see reductions in suicides, homicides, and mass shootings, and 75% of the gun owners support it. But then in communities, there are community-based anti-violence initiatives where community members are supported and empowered to work in their neighborhoods to send a message of nonviolence, and those work. And fortunately, Congress has appropriated some money as part of the most recent gun legislation. And if communities embrace that and implement it well, they'll see reductions in violence.
Dr. Sharfstein, I'm wondering, because one of the other things that I think people should sit up and pay attention to is a number of other countries that have a longer life expectancy than the United States. Given the U.S.'s tremendous wealth, it is something that's shocking and unconscionable. So what do you make of that? And is enough being done to address it?
It's amazing. I mean, I think before the pandemic, we were around number 40 in the world. And right now, I'm sure it's way lower than that. You know, we would not, if it were the World Cup of life expectancy, the United States would not be scoring any goals right now. You know, we are way down there. And it reflects the fact that we invested in health like other countries have. We've invested in health for healthcare. We spend more than any other country, but we have not invested in health. And it's important to see the distinction between those two things and to turn the ship and say, what is it that we can do to keep our families healthy, our neighborhoods healthy? And when we are able to do that, we will be more free to live the lives that we want to live.
No, we don't pay enough attention to prevention. It's kind of treating the symptoms and you know, not the causes.
And realizing that we could be doing more, that we could be doing better on all this. All right. Dr. Joshua Sharfstein, thank you for joining us, and thank you for all that you do.
Thank you very much.